So nice to see you. Ginger Hahn. I'm with Community Works. Community Works is a nonprofit. We're all across the Rogue Valley, but with offices in Medford, Ashland, and Talent, and outposts in schools and courtrooms and social service agencies, the health department, various places. We serve people who've been affected by trauma or crisis, and they're rebuilding their lives. And we take a strength-based approach to try to help them achieve some more positive outcomes as they move forward. And we are fairly reliant on government funds. About 20% of our budget right now is federal funding. We've lost 10% of that in the past year. So the 20% is what we have now. And that's about $420,000. We have about a $4.5 million budget. So the funds, so what Community Works does, we do a lot of work in the area of domestic violence. We run the Dunn House, and we do outreach around domestic violence, education around domestic violence, provide shelter for women who are victims. We help them navigate the court system. We'll go to court with them, help them get restraining orders, help them make safety plans, that sort of thing. We work with victims of sexual assault, so women who've been raped or anyone who's been sexually assaulted. We'll help them get through the medical examination. We'll meet them at the hospital. We'll meet them at a crime scene. So we have really highly specialized advocates that can work in these special areas of sexual assault in the courtroom or various things like that. We do a lot of work with youth. We have in Ashland a boys' home, a girls' home, and a school, as well as a candle factory that is sort of a sheltered vocational opportunity for the youth. And here in Medford and in Ashland, we do homeless outreach for youth. So kids who've either been kicked out of their homes or who've run away or for various reasons are on the streets, we're reaching those kids and connecting them to resources. And part of the resources we can connect them to, we have a transitional living program, so we can subsidize rent for them, and help them learn the skills they need to become independent adults, which is skills around budgeting and cooking and anything that parents normally teach kids that these kids are not learning at home. We run Helpline, and that's a 24-hour-a-day crisis call line, basically. After hours, it's the Jackson County Mental Health Crisis Line. And we have an urgent response team. So after hours, whenever there's a mental health crisis, we send the team out to see if the person is at risk and needs to be hospitalized for suicidal issues or other mental health crises. And we have a therapy department, so we do mental health counseling for individuals, families, couples, a lot of work with children and transitional age youth. And so that's sort of the common thread is people who've had like a severe life disruption and need a lot of support. So when you talk about the safety net, that's sort of how they fall into our safety net. The funds we lost a rural domestic violence grant. So women in isolated areas across the Rogue Valley, you can imagine how hard it is for them to be a victim of domestic violence and be really in an isolated area. That was a hard one for us to lose because of the women, obviously. That involved an awareness campaign, and it also helped pay for the nurses who do the sexual assault exams. So that was a big loss. We lost a grant serving homeless youth. That grant tried to keep kids who were at risk of homelessness intact with their families, so we provided respite care for the families. We were a liaison to the schools so that if a teacher or a counselor thought that a youth either was homeless or at risk for homelessness, we would send our liaison out there to work with that kid and try to find resources for him or her. And so then we lost transitional housing for domestic violence and sexual assault, and that provided 20 families a year with housing for a year. So you can see that these really are safety net services. And the final one that Dee Anne just mentioned is the Emergency Food and Shelter Program provides the food for the Dunn House, and like she said, the RFP hasn't been released, so we're assuming that potentially lost. You know, I have these moments of severe dystopia, like I can't imagine a future where there are no nonprofits and poor people are just, you know, Schad or something. You know, like I imagine the most extreme thing of there is no government help and no one cares. But then I think actually the whole entire globe is in a shift right now. You know, I mean, look at Europe, the Mayans, take it from any angle. Everything is shifting, and the cheese is being moved. And I think as nonprofits, in a way, this is a sick thing to say maybe, but I think it's an opportunity, because I think we need to look at how are we providing services, what are the most essential services, where are the overlaps in this community, where are the gaps in this community, some higher level planning about how can we reduce redundancies, and with looking externally at our entire community, but also looking internally at our organizations. And I know with Community Works, when there's not enough money, what we have to do is figure out how to streamline, you know, and it's the whole do less with less thing. But if your reporting agencies or your funding agencies are asking us to do things 4 and 5 times, 4 and 5 different ways, this is where we start to say, how do we pare that down, and how do we do what we can do and focus on the essential services, because it's really about the passion and the passion for the services we provide. So I think any nonprofit right now who's not taking a look internally about what are your core services and essential services, what are services someone else does better that you don't need to do anymore, how can we support each other, I think those organizations are not going to survive this transition we're in. The CCOs, I don't know if you know about those, but the coordinated care organizations, the whole healthcare reform is about to be a big game changer. Everything is changing. Everything's in flux right now. So we've got to be light on our feet, we've got to be flexible, and we've got to, personally, I think it's great to advocate for more federal funding. I think we all should be doing that, but like Dee Anne, I'm not counting on it. I think it's time to, you know, do some serious planning internally in our agencies and as a community about how we're going to meet the needs, assuming that funding is going to be decreasing.